Every 1 in 68 children are diagnosed with autism. According to the website, 30 facts you need to know about autism. People with this condition could be a part of your everyday life, and that is why everyone should be taught the facts so they can learn about autism. I have done extensive research on this topic, so I too could learn about it and then go on to teach others about it as well. I want to inform people about autism so they better understand how it affects the people with this condition. I'll be explaining the behavior and symptoms of autism along with the causes and diagnosing it the early on help children can get. First, I will be talking about the behavior and symptoms of autism. The behavior and symptoms of autism are different for every person. Autism is a spectrum disorder. This means that everyone is different and not two people are identical, and this is explained by the website What is Autism. People will think, learn, and problem solve differently than people who do or do not have autism. Also, some people with autism may need more day-to-day help with every little activity they have to do, while others are much more gifted and advanced than even people who do not have autism. The symptoms of autism affects different between children according to the website Autism Spectrum Disorder Fact Sheet. Kids can do things such as rarely make eye contact whenever engaging in a conversation to focusing on one object at a time. Also, another symptom is whenever a baby is being communicated or talked to and they don't make any babbling or any noises back, like they're trying to communicate as well. Some children may also have delayed speech, while others will have no speech at all. It is common for people with autism to do repetitive movement. This could include twirling around in circles or swinging their arms or rocking back and forth, which is saw a lot. While some people may have most of these symptoms and it be very noticeable that they have autism, others will have very few. There could be someone in your life right now that shows barely any of these symptoms and you might not even know they have autism. The next thing I will talk about are the causes of autism. There is no one exact cause that can be pinpointed. According to the website What is Autism Spectrum Disorder for the CDC, some risk factors are having siblings with autism or older parents. The odds of a child developing autism who has a sibling that is already autistic are much higher than those of one without. This could be because they share the same gene that makes autism, or it just runs through their family. Also, having an older parent, especially when the father is older, makes the risk of a child having autism much greater. There have been many studies and research on both of these causes, but the exact reason why they cause autism is not known. Another risk factor, according to What is Autism Spectrum Disorder, is if the mother is taking certain prescription medications while she is pregnant. If the mother takes valproic acid and thalidomide, there is a higher risk of the child having autism. Although there is no one exact cause for autism, there are still many things that play a factor and a role in autism. Lastly, I will discuss diagnosing and early on help children can get. Autism can be detected at an early on age according to the website What is Autism. Children usually get diagnosed around 2 to 3 years old, while they can get diagnosed as early as 18 months. Because there is no medical test, like a blood test or an x-ray or anything like that to detect autism, the doctor will simply look at the child's behavior and compare it to the behavior of another child who has autism and see if they share the same behavior and symptoms. If they do, that child will be diagnosed to have autism. It is best, according to the website What is Autism Spectrum Disorder, to get your child diagnosed as early on as possible. This is so they can possibly get free therapy as opposed to having to pay for it. Although some people still want the therapy for their child because they can't get them diagnosed, but they still feel like they might have autism, sometimes it might still be available. Children can get therapy at a young age to help them do things such as talking and walking that they normally would not be able to do very well. Having therapy and all this extra help at a young age will really help impact their future in a very good way. In conclusion, autism is a very important condition to learn about. Learning about the behavior and symptoms of autism, along with the causes and how the diagnosing works and the early on help children can get, is very important. So many children are being diagnosed with autism, it makes it that much more important to learn about it. You never know when you will have someone in your life who has autism, and that is whenever you will need to know the facts on autism. Thank you.